A toothache wakes you at 2 in the morning. By breakfast, you can take a painkiller, search the symptoms, book a dentist, and sit beneath an X-ray machine. If the tooth is rotten, someone can numb the pain, clean the damage, and stop the infection before it spreads. Now remove all of that. No clinic, no anesthetic, no antibiotics, no one who can even tell you what is happening inside your body. For most of human history, that was normal. So how did ancient humans survive sickness and injury without doctors? The answer begins with something tiny. At Cova Negra in Spain, archaeologists found part of the inner ear of a Neanderthal child. The cave layers are broadly dated to somewhere between about 270,000 and 150,000 years ago. The shape of the bone strongly suggests a condition like Down syndrome, probably affecting hearing and balance. Yet the child lived to at least about 6 years old. That little bone preserves a life, but almost none of the story around it. It cannot show who carried food, who watched the child near dangerous ground, who slowed the group, or who helped an exhausted parent. It only tells us this: the child was still there, year after year. And that is the puzzle hidden inside ancient bones. They often show that someone survived. They rarely show how. A healed break tells us a person lived beyond the injury. A jaw that changes shape tells us years passed after teeth were lost. Marks inside a tooth tell us that someone put a tool there while the person was alive. But pain, fever, water, warmth, rest, and daily care usually vanish. So the story has to be rebuilt one clue at a time. The first major clue takes us back much further, around 1.77 million years. At Dmanisi, in what is now Georgia, an early human lost all but one tooth. Not just before death, years before it. The jaw had time to reshape after the teeth disappeared. Tough meat, roots, and fibrous plants would have been extremely difficult to chew. So how did this person eat? Maybe the group chose naturally soft foods. Maybe meat and plants were cut, crushed, or pounded. Maybe companions shared food that had already been processed. The jaw cannot tell us exactly which happened, but it tells us daily life changed. Someone with almost no teeth survived for years in a world where every calorie mattered. That is not modern medicine, it is adaptation. Then, around 14,000 years ago in northern Italy, one damaged tooth preserved something far more direct. The person known as Villabruna had a badly decayed lower molar. Deep inside the cavity, researchers found tiny scratches. When they recreated the damage, the marks matched a pointed stone tool scraping and levering inside the tooth. Think about that for a moment. No metal drill, no anesthetic, no sterile room, just a sharp piece of flint pressed into a rotten tooth while the person was alive. The most likely goal was simple: remove painful or decayed material. We cannot know how much it helped or whether the person did it alone, but this was deliberate intervention. Someone saw a problem and tried to change it, and the idea may go back even further. A Neanderthal tooth from Chagirskaya cave, about 59,000 years old, has a large human-made hollow. Researchers think a stone point may have been rotated against the decay. That interpretation is new, but even as a possibility, it changes the picture. Ancient humans did not always wait helplessly for the body to recover. They experimented, they scraped, they cut. They watched what happened next. Yet the actions that probably saved the most lives were much less dramatic. A wound could be rinsed. Bleeding could be pressed. A painful limb could be supported. Someone too weak to walk could be given time to rest. A group could carry water, soften food, keep a fire burning, share heavy loads, or take a slower route. None of this requires knowledge of bacteria. It requires attention. A person eats better after food is crushed. A wound looks worse when dirt stays inside it. Someone with a fever needs water and shelter. A broken body sometimes needs time more than anything else. People would have noticed. Plants may also have been part of that knowledge. Traces of plants survive in ancient dental remains, and some of those plants contain compounds that can affect pain or inflammation. But the important point is not that Neanderthals secretly invented a pharmacy. It is that generations of people could observe which plants soothed, burned, sickened, or helped, and remember. In a world without books, useful knowledge had to live inside people. But what if the problem did not disappear after a few days? What if it shaped an entire life? Around 12,000 years ago in southern Italy, a young woman known as Romito lived with a rare genetic condition called NPR2-related acromosomelic dysplasia. The medical name is complicated. The effect was not. Her limbs grew in unusual proportions. She had severe short stature and ordinary movement. Reaching, carrying, and traveling would have been different for her from childhood onward. Yet she survived into late adolescence. Ancient DNA now shows that she was buried beside a first-degree female relative. Chemical evidence from her bones suggests she ate broadly comparable food to other people in the group. That matters. Romito too was not simply alive. She remained part of the group's food system, movement, and social world for years. Her companions may have slowed their pace. They may have changed tasks, shared loads, chosen safer routes, or made sure she had access to food and shelter. She may also have contributed in ways bones cannot record, including knowledge, craft, childcare, memory, or social ties. We cannot recover every detail, but the larger story is clear. Her body did not fit the usual physical demands of a mobile life, so the people around her probably adjusted. That is where survival becomes social. And Romito too was not alone. Tens of thousands of years ago, the Neanderthal known as Shanidar lived with several major impairments, including probable hearing loss, reduced vision, loss of the right forearm and hand, and an abnormal gait. He survived for years. His skeleton cannot show a permanent caregiver beside him, but it is hard to imagine his life without some combination of protection, food access, changed tasks, and tolerance from the group. This does not mean every healed bone proves love. People help for many reasons, including family attachment, duty, reciprocity, group survival, or simple habit. But whatever the motive, the result could be the same. A person who might have died alone remained alive among others. Now return to the child at Cova Negra. More than 140,000 years ago, perhaps much earlier, a Neanderthal child with serious hearing and balance problems lived for at least 6 years. 6 years of food, 6 years of movement, 6 years of danger, winter, illness, and dependence. The bone cannot tell us whether the group acted from compassion, obligation, or both. But ordinary infant care may not be enough to explain that survival. Someone kept making room. Around 10,000 years ago, farming began changing the health problem again. Larger settlements brought denser populations, more contact with animals, and diets often heavier in cultivated carbohydrates. In many places, infection and dental disease increased. Farming did not invent care. It made sickness more crowded, more frequent, and sometimes harder to escape. So how did ancient humans survive without doctors? Sometimes they did not, but when they did, 3 things often worked together. The body healed where it could. Practical knowledge reduced harm, and when one person could not manage alone, other people changed the conditions around them. That is the line connecting a tooth scraped with flint 14,000 years ago, a nearly toothless human at Dmanisi 1.77 million years ago, Romito too around 12,000 years ago, and the child from Cova Negra more than 140,000 years ago. Modern medicine transformed the odds, but the first form of healthcare may have been much simpler. Someone notices that another body is failing and decides not to walk away.